much for coming. So I'm going to talk about complexity, technology, and behavior. What are we learning? And I'm Jo. Please call me Jo. I head the Independent Evaluation Unit at the Green Climate Fund, and really pleased to have all of you here. We have more than, I think, 70 participants as of now. And so I'm going to quickly jump into the outline of the talk, dealing with complexity, what and why. And I'm going to talk about three things: building on synthesis, which can help us to explode myths. Second, yes, we can. Technology can help us. Third, the last mile, behavior matters. Yeah, so there are three things: synthesis, technology, and behavior. And then I'm going to conclude. How is evaluation practice changing? So complexity, the what and the why. Yeah. So for many of you, and I think admittedly for me as well, complexity remains a fairly complex topic, in that depending on which part of the elephant you're touching, there's going to be different definitions of it. One of the most important comprehensive definitions that I have found was in a 1991 paper, which basically talked about 3 dimensions of complexity that have helped to get me a really good understanding of what are the key issues that we want to think about when we think about complexity. Again, this is a map of Manhattan that I love to show when I talk about complexity, which is to say that for many people who are coming from outside of New York, the subway in Manhattan, sorry, not the map of Manhattan, but the subway map of Manhattan. For many people from outside of New York, the subway map of Manhattan can look complicated, but it's not complex. Once you've figured it out, you know how to go from place A to place B. That's the difference between complexity and complicated. The 3 ideas of complexity that I want to run by you today are: 1, it has heterogeneous systems and agents. Heterogeneous means different. So it has disparately different systems and agents. So for example, in climate, and the institution that I basically sit in, we have biophysical systems interacting with climatic systems interacting with human systems and anthropocentric systems. This means that there is a heterogeneity in just the systems that are interacting. So that's 1. Second, there's a network effect. That is, there is interaction. This is important because it means that the predictability or the models that you might build in for understanding just one system don't apply anymore. And the classic example of basically what is used to illustrate a network are ant colonies. Ant colonies have different roles, different ants have different roles, but the whole is definitely greater than the sum of the parts. And this is the idea of emergence. Emergence basically saying in a very simple way that because systems are heterogeneous, because agents are heterogeneous, because systems do network and interact with each other, this leads to emergence, which then gives us this idea that unfortunately Dan Rumsfeld made pretty popular for all of us, was actually first provided as an idea to all of us by D.H. Lawrence in one of his very famous books. And this is the idea of unknown unknowns. So the fact is that in complex systems, one of the things that we have to deal with is the fact that there are unknown unknowns. We don't know the things we don't know. COVID is one example. We don't know what we don't know. And this is what throws up challenges then for evaluations. How do we do it well? How do we do it rigorously and credibly? So that's what I want to think about as we go into this space today, dealing with the unknowns. And I want to talk about 3 things: knowing what we know, and innovations in this, and essentially leveraging, I think, what we already know and how we can leverage that and synthesize it. Because this is really an important part of what evaluations must do. They must acknowledge what is already known and then look at disruptions and how changes have occurred compared to systems that we already know a lot about. But really synthesizing that is really key for us. Second is dealing with uncertainty. Yeah. So, and this is the idea that, look, we don't know what we don't know, but clearly we need to understand as to how we can deal with it. And one of the tools that we do have today, and we are privileged to deal with, is technology. And then the third thing that we have to deal with is incomplete information. There used to be a paradigm within which we used to work, which used to essentially say that, look, human beings and agents within systems have a lot of information or have perfect information. The world has moved in huge ways in understanding and acknowledging that, look, we have incomplete information. And this is especially important for intentional beings, such as human beings. So diagnosing human behavior and moving an understanding of human behavior from a space which was predominantly ruled by rationality to now asymmetric information, to half information or information that we have or spaces that we as human beings know very little about, and then thinking about human behavior. So those three things. So I'm going to first talk about innovations in evidence production, and I'm going to contend that innovations in evidence production, especially of the kinds that we are seeing today, can help to build stronger and can make our evaluation practice much stronger. Yeah. So there are three myths that I feel can help to illustrate this. The first myth, examples of myths that I think where we can look at, where innovations in evaluation practice as well as in evidence production have helped us to go forward, is this idea that, look, when a crisis occurs, basically all previous learning is out of the window. Or it's so disruptive that we just don't know what to do. This has been, for a long time, this was basically the health belief in the humanitarian space. This is changing. A very nice synthesis review of looking at, well, you know, humanitarian agencies, and now, of course, arguably the entire world is in a humanitarian crisis, and so I felt it was really pertinent that we think about this together. In humanitarian crisis, it was examined, and many humanitarian agencies would think about, well, what works and how do we know? So a really nice synthesis review, which was done actually a few years ago, but I haven't seen many of these come forward since then, although some have, really looked at one of the key questions that humanitarian agencies used to ask, which is, okay, when a humanitarian emergency occurs, should we distribute cash? Should we distribute food vouchers? Should we do in-kind transfers? What works? Yeah, and this synthesizing of evidence, both qualitative as well as quantitative, and the researchers Hannah Tapnes and Shannon Ducey basically looked at 500 studies and evaluations previously, and came and synthesized that in a very intelligent way. And synthesis, by the way, is not just addition. It just doesn't mean that, you know, you take one piece of evidence and add another one. It means pooling the data and then seeing what emerges out of that, right? So in systematic reviews, essentially, they found that, look, in crisis situations, cash works predominantly, which is not to say, just like all averages, which is not to say that every time you go into a crisis situation, cash is going to work compared to, say, in-kind transfers. But on average, if you are looking to alleviate the suffering of people, even when there are no markets, it is likely that you are going to be, that cash will help people. They also found multiplier effects. Cash basically has a 2-to-1 multiplier effect on the condition in terms of the economy. And it also provided far greater nutritional choices when markets exist compared to, say, in-kind transfers of food vouchers, which then reduced the amount of choices that people had and exercised and enjoyed. So that's one. And again, the idea is to underscore the fact that we have now these methods of synthesis and methods of systematic reviews that are helping us understand as to what works. The second idea that I want to float within this as an example is the fact that in poverty alleviation, I mean, the entire story of poverty alleviation and development globally has been trying to find out short solutions as to what works to reduce poverty. And we understand that poverty is a multidimensional topic, right? So in that, we know that lots of synthesis work that has occurred now will say that, look, if you are able to provide packages of poverty that can help the ultra poor graduate, and those packages for poverty alleviation should contain, for example, training for people, cash subsidies, should provide in-kind food transfers, and should provide skill transfers for small and medium enterprises. All of these put together can then help to understand and improve the different dimensions of poverty. And what you're seeing on the left-hand side of your graph, of your screen, I beg your pardon, is looking at the different dimensions of poverty: consumption, food security, assets. And what you're looking at is what's called a forest plot. But essentially, what you're seeing is that systematically researchers and people who are trying to understand this will look at using the same package in different context to then understand, well, can we say something that can help us synthesize what is coming out of development interventions? And can we synthesize that and then build a story and a narrative that can help us understand as to what will alleviate poverty? So a multi-dimensional graduation approach can help to reduce poverty. And again, work in this area has basically spanned 6 countries and now has been synthesized. So Ethiopia, Honduras, India, Pakistan, Peru, Ghana. And this was synthesized and then essentially is helping us to understand as to what might help to reduce poverty. The third is that actually we might think that a lot of things work, but again, synthesis work is helping us understand that things don't work as well as we think they might be. So this is again an example of what is called a forest plot, right? And here the evidence is trying to understand whether water supply, whether the provision of clean water supply and sanitation and hygiene interventions work. And really, our theories of change and evaluation essentially say, of course, if you go and provide training to people, everybody attends the training and understands as to what is at stake, most people will change their behavior and will end up using chlorinated water and will hand wash. Actually, the evidence says that this impact reduces over time. So in the first 6 months, if you are, and this is essentially showing, different studies that have now been synthesized. So what it's saying is that the cumulative evidence or the synthesized evidence is saying that actually these impacts are really good. There's the honeymoon effect at the beginning, but then these impacts reduce over time. So clearly something else is needed if this is what we want to try and get to in our own thinking when we are doing evaluations. And this is then to think about what this idea of the last mile, or the idea of, well, what else should be done so that these programs and their impacts are sustained over time. So the first result I want to run by you is innovations in evidence production and synthesis are helping to explode myths and understand what works and what doesn't. And that, I think, is really one of the advantages of the times that we live in, that we are now exposed to these sorts of methodologies that we can then leverage and depend upon to understand what works. The second idea I want to deal with when we think about complex systems is this idea of uncertainty. And here my contention is that, look, with innovations in technology, and I'm also going to share a couple of examples that we have within the GCF that we are taking forward. Innovations in technology can help us to a great extent, right? So one example is the GCF, the Green Climate Fund, is the largest climate fund in the world with the largest amount of investments in just climate across the world in developing countries. And one of the questions that my team and I constantly think about is the GCF targeting well? Just as an illustration, my team used nighttime data. And again, this is of a project in Ecuador. And the planned carbon emission reduction that the project is targeting, that they are reporting to the Green Climate Fund, is basically they're saying that, look, it will reduce carbon equivalents by 15 million tons, right? And that it will affect 450,000 people who will become better off. Now, just a very basic examination of the project area. So the team went and looked at what the GIS data is showing as to what are the polygons that are occupied by the project interventions, and then overlaid this with nighttime data. And nighttime data essentially helps us to see as to where there is the greatest density of lighting. And light essentially means, big density of light, of nighttime lights essentially means that these are urban areas. And one thing we found is that even though this is a project about land use planning, we found that some parts of the project are essentially engaging in areas that have very high urban densities, and it is unlikely that they will be able to see the emission reductions that are being targeted by the project. So very simple, but something that we can use very easily to then illustrate as to where targeting may go down and maybe a cause of risk for GCF. In another example, so looking at payment for ecosystem services, which essentially provides money to people to not cut down forests. And this is work that has been done by Jennifer Garcia and some of her other colleagues. They use GIS data to understand whether payment for ecosystem services is reducing poverty and also deforestation. And this is a map of Mexico on the right-hand side of your screens, where essentially they overlaid payment for ecosystem services areas with poverty, deforestation, and other maps that they basically brought in from free and non-free sources and overlaid it. But essentially, it was the use of that data that helped them to show that payment for ecosystem services was reducing deforestation by 2%. And also that there were larger impacts in communally held lands, on lands with lower slopes and those that are closer to cities, and in less poor municipalities. So the project was being successful, and they could attribute it to the project. But also that wealth gains were not significant for people. So again, one of the concerns in this program was that wealth gains would occur to people that are pretty well off, and that's not happening. So they were able to alleviate some of those concerns. Overall, what I want to basically present in this part of the discussion is this idea that, look, we've got now a lot of innovation that's going on in technology, whether with understanding project locations, and this is something that the World Bank is doing, for example, in looking at malaria locations and where there is high likelihood of malaria. This is immunization, so this baby has a little necklace around his neck, and that's wearable data, and you can basically use that data, well, definitely to understand the immunization records of the baby, but now, of course, in contact tracing. And what I forgot to basically put into this presentation is that I have my cell phone. I'm currently in quarantine, and my cell phone tracks my location and lets the government of Korea know as to where I am and what I'm doing with my time and my movements, so that if they ever wanted to contact trace, they could do that very easily. But whether you look at sanitation, and so these are plumb lines that you can drop to understand things that are very intimate to human beings. Did you go to the loo or not? Did you go to and use a latrine or not? How much are you saving? So income data, anthropometric measures, all of these wearable data and rapid data are things that we are exploring ourselves. The big point that I want to basically present here is this idea that, look, the world, this is a brave new world in very different studies. One wonderful study that came out recently looks at social media data and then uses very rigorous methods to then show how celebrities can influence behavior change. In very different data, looking at wind speeds, you can understand as to how political economy changes are taking place just by looking at how far areas that are affected by high wind speeds are affecting people on the ground and how they are reacting in turn. Importantly, I think the thing is that when we are using GIS or spatially explicit data or rapid data, economies of scale come in very, very quickly. It lowers our costs, and examples that I can give you, what we have seen is that even the work that I've done, actually my data collection cost was 0. And I had all the data that I could possibly want to understand areas of questions of deforestation and policy impacts. And because GIS data, has essentially as many sample points, as many data points as you want, there are very few what are called underpowered studies. And these are important because they help us to increase the confidence in the work that we are doing and to increase the credibility of our work as well. In work that we are doing within the GCF, and I want to use this example where we are looking at the project effectiveness of a program in Madagascar, which is a combined public and private investment. The team has collected essentially GIS data beforehand that is being put together by the team, but also by external sources. So climate hazard, environment and forest dependency, population, all of this is available outside of what the project team is doing. But because we know exactly where they are located, we can just extract the data for those areas where the project is coming in. And we are combining that with a whole lot of other engagement that we are doing with projects. So this essentially is a dashboard that shows to you as to what are the other kinds of data that we are collecting for Madagascar. So we know, for example, the timing of the interventions. We know, for example, and are supporting the program and the project do very good qualitative data collection. But we are also engaging very closely with the program, as well as collecting both surveys, which are done at year 1, year 3, and year 5. But also tracking in a very, very high frequency way what's going on with the project. I think the big point that I want to make here, which unfortunately I don't have a slide on, is that I think the nature of evaluation, and we sit in an independent evaluation office, but the nature of evaluation also means that if you really want to be relevant, you have to engage far more while keeping that independence with project teams and with your evaluand, the people that you're trying to also serve, hopefully by getting to know whether programs are working or not. But you have to engage with them right from the beginning, and that's at the bottom of my screen. You have to engage with them right from the beginning and start to understand as to how data and technology might be used to help them in making decisions that are adaptive. So result 2, innovations in technology of data collection and measurement systems are helping us deal with uncertainty, not just by collecting high quality data, but also enabling us, because we can verify a lot of the data that's coming, to keep the independence, but still helping us to engage with project teams on the ground, because now we have another way to verify the data that's coming, which is not dependent just on, key informant interviews or anecdotal information coming from the project beneficiaries themselves. There are now possibilities for us to verify that data, which is a completely third source of verification, which is really important, but also allows us to engage much better and in a very collegial way with the project evaluants themselves. The third idea I want to run by you is this idea of delivering the last mile. One of the key things that I think we are discovering while sitting at the GCF is that, science is clearly not enough. Whether you look at obesity, whether you look at drug use, whether you look at alcohol abuse or smoking, we know that it's not just science that is going to change policy or change strategy, but not just that. It's not just science that is going to change behavior of people. So a lot of the theories of change that we have looked at, and I can talk about the 127 projects that we have looked at or investments that the GCF has made. And we found that this idea that as long as agencies are able to go into the field and to train people, then that we will witness behavior change on the ground is antiquated. That it's a very, very different world, and we have to start considering that just providing training, increasing awareness, and providing knowledge is not going to change the behavior of people. And we have to then start to think about behavior change. This is the last mile problem. The mile which is between the supply of the intervention or supply of the project, which is what agencies can best control, and the behavior change of the end beneficiaries, which are clearly the things that we think in our theories of change are basically going to come about. But the point is that we know that gap is really important for us to essentially cover. And this, I think we are helped by a lot of the new advances that are occurring in behavioral science. And this is sort of understanding the cognitive, the rational versus the contextual or the behavioral part of our brains. This is the introduction of the idea of a choice architecture into our thinking as evaluators. Understanding that decisions by people in the last mile are influenced by how choices are presented. So we like to think that everybody is extremely rational, and that once information is provided, yes, you should sanitize your water, yes, you should wash your hands, people will do them because people are rational, that they are Spock-like. But we are not. We are like the Homer Simpsons of the world. We are lazy, we want to do whatever is easiest, and we want to do basically what is instinctive. And this is the problem of, the type 1 versus, the type 1 thinking versus type 2 thinking, or as Richard Thaler essentially said, that if we are thinking fast, thinking slow, we want to take the one part of the brain and essentially transition it to the other side of the brain, where people are far more intentional about some of the choices that they are making. These are Richard Thaler and Kahneman, and basically these are the Nobel Prize winners in this space of behavioral insights and behavioral science, which also goes to indicate that a lot of this science is quite robust and is being used, notwithstanding, of course, how it's been exploited in the UK, and I'm very happy to have a discussion about that, although hopefully not during this session. But essentially this idea that, look, it really is important as to how you frame messages, how you deliver them, what you think is the default, how you highlight messages, which is really going to make the big difference between whether interventions being unsuccessful and successful. So this is Nelson Mandela, and this is the example that, look, the messenger really matters. And this is the example that, till Nelson Mandela came along, HIV/AIDS was one of the biggest curses, even socially, in South Africa, in that people essentially shunned and made pariahs out of people who were affected. Nelson Mandela came along and wore these T-shirts which said HIV positive, or which said, I'm with you, and it changed the message. It made people realize that it was okay to, hang out with people who are HIV positive. And no amount of medical science could have come forward to tell you that it's absolutely fine, but it's just having that messenger, someone who people trust and who people have trusted in the past, who can deliver that message, then changes essentially the framework within which we are working. And that essentially was covering the last mile. Another example of this is ART, so artemisinin therapy. I beg your pardon, ACT. So essentially, that earlier medicines that used to be taken, that was a big challenge in adherence. If you have 8 pills that you have to take during a day, and you have to take 2 pills every 3 hours during the day, the adherence that you're going to show towards this treatment is going to be extremely low. And this is what a lot of medical researchers and humanitarian researchers on the ground have found. If, on the other hand, you change this to 2 pills, 1 in the morning, 1 at night, it's the same pill, but you change this, you're going to find that adherence is just much better and higher. And this is the idea of changing the default. The default is not having to take 8 pills during the day, but just taking 2 pills, which is then going to change how you adhere to an intervention where you're going to become better off if you take all 8. Adherence is just very low. Third example is that of ready-to-use therapeutic foods. Everyone knows, and everybody knows that, you know, that especially in impoverished locations, that there has to be provision of high micronutrient food for children. But you can keep telling mothers that, look, they need to mix, you know, one food with the other, and keep providing grains. Except those things don't work. And then RUTF, or ready to use therapeutic foods, have provided that default where children sitting anywhere, and this can be transported over long distances, can essentially then just suck into a packet which also delivers therapeutic food for micronutrient rich food for children, increases nutrition, and prevents both severe acute malnutrition as well as moderate acute malnutrition. So changing the default rather than making it difficult for mothers to essentially cobble all of these foods together, even if they are provided their macronutrients separately, changing the default has really been one of the most successful interventions to reduce SAM and MAM, severe acute malnutrition and moderate acute malnutrition. Another that is very well known in energy or in climate change is really this idea of norm and comparing energy consumption with neighbors. So, you know, even in my city, my electricity bill actually comes with a comparison against everyone else's. And so you know as to how well you're doing compared to others. But this was tested and examined in very different situations to then understand as to whether it matters. And it is true that, you know, human beings tend to really adhere to norms that have been set by their peers. So if you know that there are others in your community or in your neighborhood that are consuming far less energy than you are, you're likely to change your own energy consumption. So having a norm can change behavior. And no amount of telling people, you know, use less water to shower and use less energy is going to do that. But once you set a norm, it changes behavior. Similarly for salience. So this is essentially an idea that we all know that we should have more fruit, fewer donuts. But if you put, instead of putting donuts at the checkout counter, if you put, you know, fruit at the checkout counter, it's far less likely that you're going to go and reach out for a donut if your fruit is nearby. Atul Gawande gave us this idea of salience, a checklist. So essentially what is important, to point out what is important. And let me just add that this behavioral insights is not just important because we as evaluators can then understand as to how we can do better as we think about project delivery and implementation, but also in project design. In fact, I can refer all of you to very nice papers that look at how behavioral insights are changing project design, diagnosis, implementation, as well as results. And knowing this literature and as well as knowing these practices can alter the way we are thinking about what is effectiveness in projects or effectiveness in development or effectiveness in climate. The last example that I want to give here is essentially this idea of reminding the brain, and again highlighting that it's not just knowledge and information that is sufficient. And this is the example and one that I've used before, so forgive me for those who have seen this example before, but germ theory or epidemiology of germs is pretty well known to doctors. So they don't need to be trained and they shouldn't have to be told that it is good to wash hands. Except in an earlier study, it was found that, you know, doctors just didn't wash hands. And this led to fairly high mortality rates, yeah? So researchers at the London School of Hygiene and, Imperial College London and University of Miami came together to say, okay, well, let's try and figure out as to how we can make it easier for doctors to sanitize their hands. So they ended up installing hand sanitizers in front of surgery rooms. This did increase sanitizing behavior, but not by as much as doctors would have liked, and even patients would have liked. So they tried a few other things, and this then, you know, refers to this idea of using the irrational part of our brain to then go into spaces that can help to really propel behavior that is socially as well as privately beneficial, both privately as well as socially beneficial, right? So these researchers then experimented with this idea that, look, when people know that someone is watching you, they are far more likely to behave in ways that is expected of them. So they put pictures of men's eyes on top of these sanitizers. They also put women's eyes on top of these sanitizers. And then they did the third thing. They basically sprayed lemon scent in front of these surgery rooms. And essentially the idea is that lemon scent, so was the idea that, look, lemon is associated with antiseptic behavior. So they then tried to understand as to which one was more effective. And again, I think I sort of gave away some of the results that you could anticipate. But you know, women looking at you was far more effective. So this is in the control. That is, just put the sanitizer and then try and understand whether doctors are increasing their sanitizing behavior. Then compare putting women's eyes essentially there. So this is the 21.6. Essentially over the 15, putting women's eyes photographs is increasing your sanitizing behavior by 6.6%, 21.6 over 15, right? Putting men's eyes is essentially increasing your sanitizing behavior by 18%, 33 minus 15. But if you spray lemon scent essentially in front of surgery rooms, what you find is that behavior improves by an order of magnitude, sanitizing behavior. And this is because the rapid part of our brains essentially smells the lemon scent and associates it with antiseptics and thinks of cleanliness, which makes us then sanitize our hands far more than one would if we just had a hand sanitizer in front of the surgery room. So, result 3, innovations in understanding behavior are helping us deliver the last mile better. I'm going to then go into, knowing these 3 ideas that we have now innovations in synthesis as well as production of evidence. That was the first result. We also have innovations in technology. And the third is that we have innovations in understanding human behavior. All 3 of which are really helping us understand the unknown parts of what complexity theory is putting up for us, and especially the uncertainty that is being generated in the situations and the paradigms that we occupy now. So, how is practice changing? What I want to present to you then in the concluding part of my talk is to say that, look, we've got to start building better. Build better in the beginning, which means that basically for complex systems, which is essentially every system that we all occupy, we've got to do 3 things. We've got to build evidence systems, and evidence systems is a combination of measurement, data, and evidence synthesis. Yeah? So you have to know how we can measure, how we can collect good data, but also how we can synthesize the evidence that is coming out of this data and measurement. Second, and this might seem counterintuitive, is to build redundancy. One of the things that makes systems resilient is this idea that you have to build some amount of redundancy, so if one part of it fails, you're still able to use another part of it. And then third is that we have to think in a modular way. So basically, some amount of disconnection between different parts of a system are very important so that we are able to still go forward if one part of that overall system fails. Second, the implication is that we have to start examining as an evaluation community whether we are doing the right things. Just to give you an example, my team and I concluded an evaluation this year where we looked at GCF, or the Green Climate Fund's own work with respect to environmental and social safeguards. And we examined not just whether we were doing things right, that is whether things were being implemented in the right way, but also whether the right things were being done, which, as you can imagine, is a pretty tall task, because it means not just that we look at what's happening within the system, but also what could be happening within the system, or to look at counterfactuals. But if we aren't able to imagine an alternative world, it's very difficult for us to make those recommendations. So we started off with essentially thinking of normative frameworks. Yeah? What is it that the GCF as an institution can and should try and achieve? And then we examine that or compare that with what was happening within the GCF. So some conclusions which have been quite hard-hitting is that, in the GCF, we made the recommendation that we have to go beyond do no harm. And second, that we have to not just say do no harm with respect to interventions, but we have to realize positive gains with respect to the environment and social aspects of a lot of the investments that the GCF is making. And this takes me to an important part. A lot of evaluations benchmark their work against other institutions. Personally, I've realized that benchmarking is interesting, but it can't be overused. It should not be overused, because we are living in a new world order, and we have to step away from how business used to be done previously. And we have to step away and imagine the world that we want to occupy now, which means it's not okay to continuously compare institutions and practices that we have now with what has occurred previously, but really to reimagine the world as it must be. And then, bringing in values, bringing in normative frameworks within evaluation is clearly really, really important. I won't go over this part, but essentially to say that, this relates to the overall strategy that we were looking at. Okay, then the third learning that I had was to build attribution, measurement, and quality right from the beginning. In every institution that I've gone to and spoken with, most people will say, well, sorry, we can't do good measurement. We don't have good data because guess what? We just didn't build it at the beginning. So we have no data, it's useless, the theory of change was bad, etc., etc. We cannot be like this bear on the right-hand side of your screen where we are constantly thinking about, oh my God, why did I do this badly? We have to sort of go past, I think, what have been the well-accepted limitations that evaluation as a discipline has essentially espoused for itself and said, well, we are never going to find data, and we're never going to be able to say anything more credible than essentially doing, good qualitative work, of which, by the way, I'm a big, big fan. So let me put it out there very, very importantly. I'm a big fan of good qualitative work, but I think synthesizing qualitative work is far more difficult than synthesizing quantitative work. And if we really want to synthesize well, and if we really want to learn, we have to use both qualitative and quantitative techniques, but hopefully this is old hat for you. But importantly, if we are building systems and measurement systems and evaluation systems, we have to build in this idea of attribution, measurement, and quality. The third is that we have to plan for a variety of data. And this is this idea of modularity as well as redundancy that I spoke about. Look, the world is always going to be having one crisis or the other. There's always going to be a pre-crisis or a pre-event situation. Then there's going to be the event or the crisis, COVID is one. And then we're going to have a post-crisis or a post-event situation, and that's recovery, and then we're going to have reconstruction. Essentially, what as evaluators, we have to make choices. We have to say, well, what do we want to compare the world with? Do we want to go back to, the pre-event space, and should that be our comparison point? Should we be looking to just see whether we have built, back better, so it's better than what we were earlier? But in all of this, we need a variety of data, and technology can help us. But this is just, and I just want you to focus on the column headings. Essentially, we can think about, looking at affected and targeted areas within our own institutions and saying, okay, what data can we collect for those? We can also look at affected but not targeted areas by our institutions and say, look, do we have data for those? And frankly, with GIS data, with rapid data, we have the possibility today. And then we can also, if we have the luxury, we can look at unaffected areas and see whether we can get data for that. But all of this, and this is the idea of redundancy as well as duplication, can help us to understand impacts in very, very different ways and effectiveness of programs in different ways. So it can be pre-event, it can be immediately after an event, or reconstruction, or recovery, etc. And this is just a simplistic sort of table that actually Alison Butenheim at the University of Pennsylvania put together when we collaborated with her in my earlier life. But I found it really useful to think about what kinds of data and at what times of data at what time should data be collected, whether quantitative or qualitative, so that we can understand programs and their effectiveness, as well as policies and their effectiveness. So building from the beginning, I think if we are setting up measurement systems, thinking about timescales, and it's sort of associated with the previous idea of thinking about when we are going to be collecting what kind of data and how, using technology, and also thinking about synthesis of evidence that we have been handed over till now, I think are key things that I'd like you to take away. Last two slides on conclusions. First set of conclusions. Innovation and evidence synthesis is helping us explode myths about things that work and things that don't work. Second, innovations in technology are helping us to measure better. Third, well, they're also helping us to reduce costs and also have pretty good implications in terms of ensuring that we are not underpowered in our samples and have adequate numbers to understand key behaviors from. Understanding behavior is helping us deliver as well as understand the last mile and the impact that uncertainty has on human beings as well as other parts of complex systems. The second set of conclusions is that we have to change evaluation practice. With complexity, we have to think about measurement systems, we have to think about modularity and building redundancy. We have to think about strategy. We have to ask the question, are we doing the right things, and not just ask, are we doing things right? Third, we have to build attribution and measurement systems right from the beginning. And fourth, we have to build for a variety of data. And this idea of redundancy and modularity is really, really important, especially as we go into a completely new world order this year. Thank you.
Thank you, Jo. Yeah, so it's a long presentation, but you explained it so nicely, and your concluding section was very, very nicely. You summarized all your key issues from your presentation. We already have very interesting comments and some questions in the chat box already there. But before I go to those questions and comments, let me also tell you that some of our participants already asked that if this presentation can be shared with the participants. So that from a few participants already asked that question. And so let me go back to some of the questions that pretty long list of questions. So yeah. So so I think one question is here that somebody asked that in emergency, how we can prioritize areas of work for synthesizing innovative intervention. Something parties are in conflict, which are in priority. So this kind of question is there. Also one question is that could you please tell us how to use the limited data during the emergency for analyzing. So, and definitely a lot of questions are there on human behavior and understanding human behavior. I think let me go to one of those questions here. I think it's a very nice comment here that we have to be careful when we conclude cash transfer works best in the crisis situation. This highly depends on the extent of the crisis and food production capacity and supply situation of that area. In the areas where there is limited food production and supply, food transfer perhaps is the best option. So someone commented on your one of your initial comments on Mythbuster, and then I think do you want to start with answering these questions, and then I can come back to the next set of questions on human behavior, Jo?
Yeah, happy to do that. So I think on the first question, I'm sure, actually, how can we prioritize areas of work for synthesizing innovative intervention? I'm not sure I sort of get it all, but let me just try and explain what I was meaning. I don't think synthesizing evidence means that that evidence has been produced already, right? And you're synthesizing, and you do have to spend quite a bit of time trying to synthesize it. So just to give you a little bit of an example, we're in an emergency situation as of now. As you all know, we are all in an emergency situation. As evaluators, my team has to produce a very strong evaluation on adaptation. Is the GCF doing what it needs to do basically for adaptation, but also what else could it do? And so we are thinking this in very strategic ways. But one of the things that we have done already was to do a very nice synthesis of all of the high quality evidence in the adaptation area over the past 20 years. So we've looked at all high quality evidence, and this is not just through Google search. We've got a library scientist who works with us to understand, all of the key concerns that we have in terms of quality, and we set the criteria for what is considered high quality, and we've done that work already. Then to see a few things emerging for us from this synthesis work. The synthesis work essentially is showing to us that, and given that we are going to be quite limited in our abilities to, go to project areas basically for the rest of the year, we are really resorting to understanding what we already know in the resilience and the adaptation work that has been done in developing countries globally, to then understand as to how we can use that to understand what GCF's work is, what is GCF's work in this space. So I think the point that I'm making is that if you are building that tradition and that discipline of good synthesis work within your practice as evaluators, then that might seem redundant last year when we did it, but it's turning out to be just the perfect requirement in a world which is a COVID world, where we know that we are going to be unable to go to each one of the project areas that we'd like to go to, but which we are now using to understand as to whether the GCF is doing well by itself or not. So that's what I wanted to say in terms of synthesizing evidence. And we are using this to understand forestry innovations. We are using this to understand also private sector, what works in mitigation, what doesn't work, what works in results-based payments. All of these are essentially areas where we are consolidating and synthesizing previously found evidence so that we stand on the shoulders of giants as we go forward, so that we don't have to reinvent the wheel for the GCF, and we don't have to rediscover for the GCF what is already pretty well known in terms of what works. But we want to then take the discipline forward, take the practice forward, and say, this is what you can do additional to what we already know in this space. So I don't know whether that helps, Rajiv.
Yeah. I think you explained it quite nicely. Before I go to the next set of questions, I think I should mention this comment from Christina, that evaluators have an important role in changing views of contractors. Evaluators themselves need to enlarge their views beyond methodologies. So the idea that we go beyond what we had is very important. So new narratives need to emerge from the work we have already done. So I thought I'll just highlight this comment, and let me also go to the next set of questions here. Primarily, most of them are on measuring behavior. One is like, any thoughts about how to increase information rate for measuring behavior? And how do you ensure communication between stakeholders is establishing during evaluation? Another question is there, is complexity being contrasted with simplicity? Reference to the Dave Sorden framework, where would we locate chaotic and complicated quadrants? I am wondering whether there is no complexity continuum. If so, are methods or measurement the same? And another question, I think the last one, how can you bring in behavioral science in evaluations when the project design or intervention lacks the lens of behavior insights?
I agree. That's a really good question.
Yeah.
Okay, so let me take the first one. I'm sure, again, Josephina, I'm not sure I understand how to increase information rate for measuring behavior. You mean information on behavior? And if that is true, then actually one of the things that we use also, and you know, a Madagascar example was a good one, but I think what we are doing is to think about, you know, rapid data collection. And so in previous work that I've been involved in, so for example, sanitation and, you know, open defecation, which is a big problem in India. What we looked at was, well, you know, you can keep asking people, do you use a latrine? And people, you know, there's social desirability bias in people's responses. Everyone's going to say, yes, of course we do. But 500 million people in India basically openly defecate in the fields. And this is the problem of not changing behavior. Everybody knows they should be doing it. In fact, they'll give the right answers, but you know that at a level of the community, that just doesn't happen. The same thing happens for hand washing. The same thing happens for chlorinated water. The same thing happens for cook stoves, efficient cook stoves. There's a social desirability bias. So understanding that first is really important. But then understanding that, yes, you can have third, you know, other technologies that can help you to verify whether responses, at least at the community level, can be verified on the ground, are very important. So in the sanitation behavior, we use what are called plumb lines. And you know, there are experts who basically, these are sensors that are installed where you can verify both at a community, but also at an individual household level as to whether the responses that are coming from households are the true ones. Right? In efficient cook stoves, you know whether they are using them or not, because again, you can install sensors and rapid you can install wearable data as well. So for example, the baby's, you know, neck thing, you know whether the baby has been immunized 3 times or not, which is what is expected in the first 2 years. My example is, I know I should not be stepping out for the, you know, for these 14 days because I'm in self-isolation currently because I'm in South Korea. Everybody, we all as intelligent human beings know, but I know what is the method of verification. The government of Korea and the city authorities of Songdo know that if I was to step out, my phone would relate to them as to whether I'm stepping out or not, because this is my ankle bracelet. So I have my location services basically on. My point is that, look, we all know that there are certain behaviors that we have to espouse, but we don't espouse them for different reasons. And the entire, you know, literature in behavioral science will take you through all of that. But technology is our way of verifying whether we are just giving, you know, socially desirable responses about whether we're using insurance or not. You go and speak to developing country farmers. Everybody will say, oh yeah, we'd like to use insurance. A lot of surveys will tell you that. You actually go and give insurance to developing country farmers, and I've done reviews of this, will actually show you that uptake amongst farmers of insurance is devastatingly low, less than 20%. So technology can help us deal with these challenges between what is socially desirable and what can be verified on the ground. That's the point I was making. Ratna's asking, how do we ensure communication between stakeholders is established during evaluation? I think we do another webinar on this. Yeah, I mean, clearly this is important, but there are so many types of stakeholders and so many types of beneficiaries. And I think, again, this is something that's very close to my heart. I think it's really, really important to train evaluators. We think people can just come and be evaluators if they've just done project design or implementation. Evaluation is a very separate discipline that you have to be extremely well trained in. So if during an evaluation you don't have techniques for, you know, triangulating, or you don't know how to develop theories of change, and if you don't know how to do, you know, certain whatever be your methodological discipline or your data collection discipline, if you're not well trained in some aspect of it, I think it's a pretty big challenge. It's a very different hobby horse of mine, and I'm happy to discuss it at a different point, but I think I'm probably going to punt that question for now because it's really a big topic.
Yeah.
is complexity being contrasted with simple and simplicity, etc.? And should we locate chaotic and complicated quadrants? Complexity continue. Okay, no. Complexity is not being contrasted with simple or simplicity. Complexity is, so just to explain, we try to understand as to how, and there will be a paper that's coming out that, you know, my co-authors and I are working on, is that in a first paper, so you can go to the IEU website and actually take a look at it. We looked at a whole range of GCF projects, and we said, okay, can we try and understand whether these are highly complex, medium complex, and no complex, right? And then could we try and understand whether highly complex programs and low complexity programs would have different evaluation techniques. So we were able to create what's called a rubric of complexity, and I'm happy to share with you a reference to that paper as well. I invite you to take a look at it. But we are now publishing a sequel to that paper where we essentially look at the rubric. So it was 10 criteria that we looked at. You know, how many sectors, what kind of types of stakeholders, just basic simple proxies that we could use to understand the complexity of these programs that would help us to understand as to whether evaluation techniques themselves should change because programs are highly complex or not complex. And I think that's what I want. I mean, I didn't have the time today to go over what is clearly a huge topic, but I really invite you to come and perhaps engage separately with me on, if you're really interested in the space, and perhaps we could use you as a reviewer as well on one of our papers. And then Luna, your question was, how can you bring behavioral science into evaluations when the project design interventions lacks the lens of behavioral insight? Excellent question. In fact, when we looked at GCS portfolio, we found that 93% of the projects, which is, you know, just 7% less of perfect, 93% of projects assumed that there would be this leapfrog behavior, that yes, you supply the intervention, you provide the awareness and the training, etc., and that people would change behavior. Clearly, that doesn't happen. So this is our key learning, that look, you've got to start to build that in. And so one of our key recommendations that will be coming out in an evaluation, you know, imminently will be, you have to look at this last mile. But then I also referred to, you know, how behavioral insights can help you design projects and interventions far better. So in our work, when we speak, and you know, the secretariat will tell us, well, can you tell us how to design projects better? One of the things that, at least in a friendly way, I will tell my colleagues in the secretariat is think about that last mile. So we've got an $800 million portfolio in the GCF, which is just dedicated to climate information services. And the task team leader there is truly excited about understanding what these last mile challenges are, so that he might build them in and provide them as directive to the project designers. And then our task will be, we don't want to just make, you know, a evaluation 101 conclusion, oh, you don't know anything about the last mile. Our task, we are pushing ourselves as evaluators as well. And so hopefully when the projects come back, we will be able to see as to whether the behavioral insights that they are incorporating as a consequence of the advice that we've given them are truly going to be effective and efficacious or not. So that's what we want to push the frontier into. So really asking the much more second generation questions rather than the first generation questions. Rajiv, I'm going to stop here.
Yeah. Thank you, Joe. Thank you so much. Just one last question. I think if you want to respond to that question is,
sure.
How can you synthesize behavioral science through contactless intervention with direct beneficiaries, like in the current pandemic situation where there is a lockdown in some setting? So do you have any answer? You want to respond to that question?
How can you synthesize behavioral evidence?
Evidence through contactless intervention. I mean, I think
intervention with
like, no, in this right now, in this pandemic situation when everything is locked down in many countries, in India, like a lot of relief work, a lot of relief measures are going on, and a lot of people are interested to study the impact of that pandemic and that relief work. Maybe the person has come from that context, perhaps.
Yeah. I'm not sure synthesizing behavioral evidence is one question. How can we evaluate programs through contactless intervention maybe is the other question. I have to say I'm struggling a little bit to understand, the entire question. So I apologize, Ronald. My own understanding of the question is somewhat nascent, but I think one of the things, and I actually ended up writing an article about this, which also got published in the Indian newspapers recently, was we forget, as a race, we forget that, look, crises have come and gone. We have dealt with them. We have tried to understand as to what works in crisis and what does not previously as well. It's just that this time, because it's global, everybody seems to be in a state of shock. But, the humanitarian world and the disaster risk reduction world has dealt with these sorts of issues before. And so I have an entire article where I go through understanding as to what can we, okay, I want to understand. So Mushfiq Mubarak has done quite a bit of this very interesting work in the COVID world in Bangladesh, to then say, look, if you want to understand, the plight of a lot of the beneficiaries, you can create what are called sample frames. Sample frames essentially mean that you have to know the population that you're targeting, but you can create, rosters of telephone numbers and you can call them on the phone. But there are some rules. These are very different from going and doing, one-on-one surveys, which take 2 hours and which is like an LSMS. It's a phone survey. You have to be 30 minutes or less. At a maximum, take 20 minutes to do a phone survey. Be very precise about your questions and be very sensitive that people are spending their time on their phones talking to you. So there are some do's and don'ts as well. And there's a very, very nice, separate piece of work I can refer you to that tell you about how to do these through using phone surveys. And again, I can perhaps as part of the overall mailing list, I can send you all these resources as well.
Sure. Thank you so much for your comment on it. Definitely, it's very useful and the references. Great. So I think we can stop here perhaps. But before we close the session formally, just let me tell you that this webinar was part of Eval for Action Decade campaign. And this campaign is basically for seeking to promote widespread recognition on evaluation being critical and a key accelerator for achieving the global goals. It will mobilize commitments by different stakeholders, parliaments, governments, evaluation associations to invest in stronger evaluation systems to inform public policies, ensuring no one is left behind. And United Nations Population Fund and the Eval Youth are the co-leaders of this campaign. So that I just wanted to tell, because we had a presentation, not short, like one slide on this, but we couldn't do that for that nasty disruption in the beginning. So great. So now may I request someone from the organizers to deliver the closing remarks. I think Erika was supposed to give a 2-minute closing remarks on this webinar. Erika, are you there?
Yes, yes, I'm here. Thank you so much, Ms.
Great.
Sir Ranjit. So, on behalf of the Asia Pacific Evaluation Association, my name is Erika Lareza, and I work as the secretariat of APEA. So, I would like to quickly part on what my takeaway from this webinar. So, as an evaluation community, we need to improve and innovate our practice, whether it's an improvement of measurement systems, being more modular, being strategic, building attribution and build high quality synthesis, or being redundant to have more rigor in our data. We all need to remember that change is the only thing constant in the world. Change will always happen. Unfortunately, there will always be a crisis, whether it's on a global level or in some other corner of the globe. As the evaluation community, we need to learn how to adapt, to be innovative in conducting evaluations, and at the end of the day, always ask ourselves if we are doing the right things and if we are doing it right. So yeah, we would like to I would like to express our thanks to Ms. Jo from global from Green Climate Fund, and of course for Sir Ranjip for moderating this event. So thank you so much. I think Seva will also have a few words before the end of the remarks of the end of the webinar. Thank you so much.
Thank you. Thank you.
Thank you, Erica.
Oh, our next webinar.
Was Siva going to come on?
Chamatkara?
Chamatkara, were you going to come on?
Yes, on behalf of Sleva, yes, there's a disaster, but we could manage it, and I appreciate Joe for the quick preparation, and Joe's team for the quick preparation for the starting it again, and also all the participants after the issue for logged in, but I know we couldn't get some participants because we had to lock the room.
Yeah.
Yes, we had to lock the room because it was not sure again. Something was happening. So I thank you all and Erica for the closing remarks. And I just want to mention and Mr. Sivanand Soti, he was prepared to give the welcome remarks, but he couldn't do it because of the issue happened in the beginning. So I thank you all and thank all the participants, and we will share the webinar recording with all of you, all the registered participants also. Thank you very much.
Thank you. Thank you, everyone. I really appreciated this, Chamatkara and Rajiv and Erica, and on behalf of my team for putting this together, and of course to Siva. I'm sorry that we couldn't have him at the end, but I also want to especially recognize my team, not just of course for all of the back and forth that they did, and Asha and Jonji and Cortland, but also in disseminating the information, and also being also in adaptively managing the crisis or the disruption that we witnessed at the beginning, and coming back to it with great elan, and building better than what we had expected.
Absolutely. Excellent.
Yeah. Thank you so much. And we'll be in touch, and we'll also send you the other resources that I mentioned.
Sure. Thank you.
Thank you, everyone, and have a good night. And I'm going to call off from Korea. My team has been working tirelessly, and it's almost midnight. So especially thank you to Asha and to Yonji and to Cortland and everyone else who joined from IEU. It's kind of late here. And thank you everyone for being there, and appreciate your presence, your engagement, and the excitement that you shared with us. Bye for now.